Well, hi everyone. Welcome to the next session on this year's START Virtual Assembly. Thank you for joining us here today. My name is Ian Burbidge and I'm Head of Systems Innovation and Change here at START Network. We'll be discussing a critical question. How do we know if our work is changing the system? And to help discuss this question, I'm joined by Charlie Ledbetter. Charlie's the co-director of the System Innovation Initiative, helping develop practical approaches to shifting big public systems. He's an independent writer, advisor and speaker, and most importantly for us here today, he helped develop the keys to system change that he'll touch on later. I'm also joined by Felix Okinyo. He's the lead software designer from Digital Storytelling Africa, an organisation that helps nonprofits grow and accelerate their impact. We've been working with Felix and his colleagues Otieno Arnold and John Alosso, who have been developing the playbook microsite for us, and we'll talk a bit more about that later. So here in today's session, I'll start by setting the scene behind the question that we're exploring, and then I'll invite Charlie to talk a bit more about the ways in which the keys to system change can help us on that journey. I'll offer a short introduction to the playbook before handing over to Felix, who will do a demonstration of it for us. As we go through this morning's session or this afternoon's session, depending on where you're joining us from, do post your questions in the chat as the session unfolds, and we'll get to some of those if we have time at the end of this session. And then I'll wrap up and offer some next steps and some ways in which you can get involved in this work moving forwards. Great. So let's kick off then. Why do we need to know if our work is changing the system? Well, here at START Network, we have a clear vision of a locally led and proactive humanitarian system. And we set this out in our current strategy, which we published in January. To achieve this vision, our mission is to be a disruptive force for change within the system in critical areas that align with our strengths. And such clear purpose can help galvanize action and can help release energy for change, not just in our work, but also in the work of our members and partners, those of you on this call here today, and others across the wider system. Because, we know that system change isn't the preserve of a single organization acting alone. We know it needs collaboration and cooperation, and actually it needs a movement for change. And that's what we're trying to seed here in our work at START Network. Because system change isn't something we can ever say we've completed. It's what Simon Sinek calls an infinite game. Even if we think we've created change in the areas that we want, complex dynamic systems have a knack of emerging and evolving in often unpredictable ways. And we also see that too often, too many interests are well served by the system as it's currently organized. And this can make change difficult. There can be few incentives to do new things or to do things differently. And it's also not enough just to do great humanitarian work. Of course, the world needs that. But we believe that greater change at the scale of the systems that comprise the humanitarian sector can emerge if we're able to also help shift the system in a more favourable direction. So how might we do this? And importantly, how do we know if we're being successful? Well, these are some of the questions we're seeking answers to as we implement our strategy over the coming years. They're difficult questions and their answers aren't easy. So to help our teams and our members and others across the system seek answers to those questions, we've been working with a set of keys to change. And Charlie will introduce these shortly. But for now, let me say that we believe that these keys can be the link between that great work and great work that shifts the system or creates the possibility for change within the system. Because if we look at the system through these keys, as we deliver our programs, as we design our experiments, as we develop our ideas, we stand a reasonable chance of creating change within the system. We think that these keys can help us achieve this alignment between our great work and between the change that's possible. If we don't, we run the risk that we'll deliver great work that helps affected communities, but we could be left to hope for the best in terms of whether we actually create change in the humanitarian sector along the way. So over the last few months, we've been pulling together the best of everything that we and others have learned about system change over the years into a playbook. A playbook's basically a way in which we've pulled these insights and models and framings and approaches together in a way which is a practical guide for people to help link your work and our work to the change that's needed or possible within the system. And we've based it on these keys to system change. So before we have an early look at the playbook, let's dig into these keys to change in a bit more detail. And to do that, then who better to have with us here today than Charles Ledbetter, who, as I said in the introduction, was instrumental in pulling this framework together. So, Charles, welcome again. And as I scroll through to your slides, over to you.
Thank you very much, Ian, and thank you for everyone joining. Ian, are you going to run the slides or should I share my screen?
Whatever's easiest for you. I'm happy to
probably,
click through if you'd like.
Probably best for me to control them if that's okay, because
sure.
I think I just need permission to do that. There, let's go to that. Can everyone see that? I hope.
Looks
good.
Perfect.
So, yeah. So I'm currently in Copenhagen, where a lot of this work began with an organization called the System Innovation Initiative, which has since become System Shift. And we have spent the last sort of 5 years trying to understand people who navigate big transitions and navigate their way from one system to another system, an alternative way of organizing ourselves to achieve different outcomes. And the very simple way that we think about it is that if you have a system, which is a kind of integrated set of components that come together to achieve a reliable outcome, that in a lot of the systems that we deal with, care systems, education systems, health systems, there's an enormous amount of change, adaptation, attempting to improve the system from within. And you see that in humanitarian systems and systems in countries where humanitarian aid is working. And what we're interested in is when that kind of change becomes something different. It becomes moving towards a different way of working with a different kind of purpose and different underlying principles. So that orange dotted line is what we're interested in, and how that happens and how people make that transition. And it's very, very interesting, obviously, looking at humanitarian systems, because they are systems, not a system. It's often quite a conflicted system, different players, different interests. And what you see in humanitarian systems is what you see in many systems, is that a new idea comes along, like localization, which seems to offer, perhaps important change, and actually it gets sort of dragged back into the current system. It becomes part of the current way of doing things, rather than offering an alternative and a different way to create an entirely different kind of system. So localization, I think, is a sort of hybrid idea. It could just be a different version of the current system, or it could open up something very different, a different kind of way of thinking about the fundamentals of these systems. And so when we're talking about systemic change, we're thinking about things which go deeper. So they go deeper than the surface symptoms. They're not just responding to the evident and immediate symptoms. They're trying to get to deeper causes. They probably go earlier. So they're trying to prevent things rather than respond to things. They're going wider because they involve a wider range of players, because systems are complex things with many different players. So Generally, you need alliances of people to come together, and they go longer. And they go longer because the time frame of change is much longer than a particular intervention. So when we looked at people, organizations, places where this kind of transition had been possible from system one to something completely different, what we found was when you boil it down and when you take away a lot of the particularity and the complexity of systems change, which can be very disabling, when you boil it down and make it as simple as possible, these four things were the raw materials of change. And if you want to shift a system, you have to work with these four keys. And so the four keys are the purpose of the system, what it's for. Purpose can be stated, a vision statement. It can be unstated, implicit in the way that people behave. A purpose, as you're changing a system, can be set in advance. Our purpose is to go to the moon, or it's something you can discover as you're innovating something. So purpose is both something that can be emergent in a system as well as being determined before the change takes place. We think it's much more often emergent. Power, who has power, in what form, to then challenge or to change purpose or to entrench purpose. And often you can't open up the purpose of a system unless you open up power relationships. Power can be soft, it can be hard. Often the most important forms of power in a system are not hard power, money, rules. They really are important, but it's the soft power of norms, conventions, assumptions, mindsets, paradigms, we call it a kind of force field that keeps a system in place even when it's breaking down. And I think with humanitarian systems, you definitely see a version of that everyone thinks this system doesn't really work, and yet somehow we're complicit in keeping it working, even though we know it's not fit for purpose. Resource flows mean not just money and people and buildings and other assets. It means knowledge and information. It means resources of technology, but also reputation, of trust, social relationships. So how do the resources flow through systems? As Ian said, often there are resources, they're just not flowing in the right kind of way. And so the question of whether you start with a need for more resources or you start with, sometimes radical change starts with a lack of resources, or it often involves the reallocation of resources. And then relationships, by which we mean what's the sort of relational architecture of the system? Is it hierarchical, or is it more distributed? Is it more egalitarian? Is it more mutual or more transactional? And how are relationships ordered? And again, the power and relationships ordering in humanitarian systems is closely related then to their stated and unstated purpose and the way that resources flow. So if you wanted to create a radically more effective system of humanitarian assistance and aid, our hypothesis is that you would have to work with these four things. And whatever particular thing you were doing, whether it was a financing mechanism or it was a new way of engaging with governments and power, or it was a new design for organizations and relationships, you would keep coming back to these four keys. So let me just quickly explain what that means with the help of a story of a particular change, and this guy, Alvaro Salas. Alvaro Salas is one of the most remarkable social innovators and public leaders I've ever met. Alvaro Salas was born here in rural Costa Rica, 1955, when 1 in 100 babies died before they were 1 year old. Cemeteries in Costa Rica had special plots for babies less than a year old. Life expectancy was, for men, 18 years less than the United States, and communicable disease of a kind that had been eradicated in the developed world was rife in Costa Rica. And Alvaro trained as a doctor and was outraged that this was the case, that why should Costa Rica and Costa Ricans have such lower quality of life, length of life than other people in richer countries. And the fact that his hospital was 40 miles from where he was born was to him an affront and also an opportunity, because his conjecture was, well, maybe we've actually got the resources, or we can imagine ways of creating the outcomes we want without having this traditional medicalized hospital system. And so over a long period of time, and it took a long period of time, even if he'd done it in the best possible conditions, it would have probably taken at least 15 years. Actually, it took Alvaro longer than that. He went from developing an alternative to working inside government to working regionally, became an advocate. But at the core of it was this new kind of health worker called an ITAP, a kind of health technician, not a doctor, more than a nurse. And ITAPs, literally, this is the health system of Costa Rica, the community health system. It's on a moped. He's got some vaccines, he's got some tests, he's got a computer, an iPad, and this guy will be part of a team of 7, and they'll look after 7,000 households. And there are scores of these teams across Costa Rica providing community-based health. And this is what they do. They go door to door. They know they've got good information. They know where the need is greatest. And so they form important relationships and, if you like, alliances with people in the community to help the people in the community look after their health better by providing timely advice, support, connection, and building up social relationships so that there's an underpinning of social relationships to support their health. So what did Alvaro do here? Well, he said he started with purpose in a way. He said traditional health systems are about curing acute illnesses. Actually, we want something that's much more preventative. But we start with a purpose that we should have as good healthcare as any other country in the world, developed or not. And so he started with this profound sense of moral purpose about his work, but framed it in a new way. So if you want to shift the purpose from curing illness to preventing illness and living well, there are big questions about power, particularly the power of medical doctors, of experts, of that kind of model of healthcare. So you need to shift power, and you need to shift power towards this more communitarian healthcare system and towards citizens and out of these big systems. So that means shifting relationships. So you can't shift power unless you shift relationships. So you need new relationships forming, which are less hierarchical, less expert, knowledge-driven, more peer-to-peer, which recognize informal learning, informal knowledge. And then you need resource flows, which are much less siloed. So it's not just about health budgets, but they're more joined up and more distributed. So critical thing that Alvaro did was that he became the first owner of a combined health and social care budget, which created some of the resources to create this much more distributed community-based system. So just quickly then, that's how Alvaro used those 4 keys. How can you use the 4 keys then in that spirit, if you like, to start shifting a system? Well, the first thing you can do is use them as a diagnostic. You can say, how is this system currently configured? And by and large, we see 3 patterns, I suppose. There are systems where these keys are so locked together you can't prise them open. The system is completely entrenched. There are other systems where the keys are sort of flying all over the place and they're really at odds and there's a lot of conflict. So one thing to do is use the keys to understand how the system is configured now. A second thing you can do is form a vision of an alternative. And that's what Alvaro had with his small team. They had this vision from really early on about a communitarian, community-based health system. So that's about reconfiguring the keys, turning relationships and power in a different way to open up a different purpose. That creates a different flow of resources. So they had a diagnosis and they had a vision, but importantly, what you also need is a strategy. So what the keys also do is give you a sequence. So you can start with any key. You can start with resources, power, relationships, purpose. You can start anywhere you like, but to really shift a system, you've got to use all four. So you can start, as Alvaro did, with a sense of purpose and a lack of resources, which leads to you thinking about power and purpose. We've seen other people start with relationships and purpose, and that shifts power and resources. So you can start anywhere, but you will in the end, you will end up using all four keys. And the keys then give you a way of thinking about evaluating progress. How can you track these changes to know that you're shifting a system? So this is what I would just leave you with as our version of how you go from on the now side, the current system, diagnosing the current system, how these keys are configured, to the vision side, how do you want to see them configured? And the key work is in the middle, which is where do you see pressures, opportunities building up inside, outside systems for this reconfiguring to take place? Where do you see possibilities of new things emerging? And the big thing that I would say just finally, and I think this is, I know this is really, really hard in very hard pressed humanitarian systems which are dealing with all sorts of pressures at the same time. But the key thing is to, I would say, is not to keep going back to the problem, but to start with the possibility, to use the keys to think about the possible future system that you want to create and then go back to the problem. If you start with the problem and never then really engage with the possibility, you will get dragged back into the system that created the problem. So you have to use it to create a sense of what the possible future might be. I'll leave it there, Ian.
Thanks, Charlie. Really helpful and really helpful intro to the keys, but also some really good insights for us to reflect on in terms of what that means for how we go about creating the kind of change that we want to see and that we know is possible within the humanitarian systems. Great case study from Costa Rica as well, bringing it to life for us. What we're going to do now is we're going to talk a little bit about how we've worked with those keys in our own development of a playbook to help members, those of you on this call, others across the system, apply some of these insights in practice. And before I hand over to Felix, who's going to demo the playbook for you all, I thought I'd just talk through a little bit about how we've done this. We've brought together the keys that Charlie and his team have been developing, and we've added the notion of practices as well to this, so that we can talk explicitly about the things that we might see people doing within the new system as well. And we've brought this together into an approach to system change, which Felix will overview. But it looks a bit like, as Charlie was saying, starting with imagining a new purpose. What's the possibility for change? Where do we see that change might be possible? And then we start to think about how could we redistribute power and strengthen relationships and shift resources and change practices in a way that helps us. And layering through that, we talk about how we show up within the system and the reflective practice that's necessary to ensure that we're learning as we go. Because that's a crucial thing for me when we're doing this system change work, is it's really, you know, there's no kind of utility in setting out a plan and logically following the plan stage by stage by stage, but we need instead to ground ourselves in where we are now to understand the possibilities of the present whilst having a sense of the vision that we might be working towards. And so the playbook is designed to help people navigate that, because as I've seen in the sector, it's very kind of focused on, you know, standard approaches of log frames and delivery plans and, you know, all the usual monitoring and reporting requirements. And system change is slightly different. And I think what we saw with Alvaro's example in Costa Rica is someone who saw the challenge, imagined the possibility, but then they didn't go away and sit in a room and plan out in detail how they might approach that. But I'm pretty sure he just got started building those relationships, testing out different alternatives, building alliances. And it's that kind of experimental approach that needs to be at the heart of what we're doing. And again, the playbook is here to support us with that. So let's, I think Felix is on the call. Felix, shall I play the video and then hand over to you? If you want to unmute, is that going to work for you?
Yeah, that's okay. That's okay. I hope you can hear me.
All good, Felix. Okay, let's go. Let's find the right bit. Right, okay, hopefully this will all work for everybody. Fabulous. Let me stop sharing. Felix, thanks so much for you and your team for working with us on bringing the content together. Let me hand over to you to give people on this call a first heads up, a first look at what the playbook's beginning to offer. Over to you.
Okay, thank you, Ian. I hope everybody can see what I'm sharing on my screen right now.
Yeah, it's all working great.
Yeah, so we developed the playbook. The playbook is basically a practical guide to systems change. So it has sections that define what systems change is. It also has sections that explain why systems change is necessary. It also has sections on the different approaches that you can use to achieve systems change in your organizations. At the tail end, it also has the tools that you can use to apply systems change. So this is currently the homepage of the microsite, and it's an entry point onto the different parts of the playbook. The parts that define what system change is, the parts that explain why it's important, and the parts that detail the approaches that you could use to achieve systems change. So, for example, if you wanted to know more about systems change, like what is systems change and why is systems change necessary, you can go to the About Systems Change menu item, and you'll find a listing of resources that you can read to understand what systems change is, for example. So like currently the page that I'm on talks about systems change by basically just giving a definition of what systems change is and explaining more about systems change. If you wanted to know why systems change is necessary, you can go on under the Why Systems Change tab, and it also has resources that you can click on and just read through to understand why it's important for an organization to undertake systems change. Yeah. Then it also has the approaches to systems change, and these approaches, as Ian explained, they borrow from the keys of systems change that Mr. Leadbetter was just talking about. So under this, they are encapsulated under this spiral diagram. So on the spiral diagram, you can see different topics. Yeah. So if somebody just wanted to know how to start on undertaking systems change, there's a, as part of the spiral diagram, there's a section that says understand where to start. So you could just click on that, and it will take you to a page that has more details about how to start on this process. Yeah. So the different circles on the spiral diagram outline the different approaches that somebody could possibly use to guide them on the journey, on their journey while undertaking systems change in their organizations. Yeah. So if you wanted to imagine something to guide you on how to imagine a new purpose, then there's also a resource that you can follow up, you can click on and just go through it to understand how you can imagine a new purpose. The steps that you could use to imagine a new purpose. So they are encapsulated in this page. Then you'll also realize that in systems change, you need to use some tools. Yeah. So in the same playbook, we have a systems change toolkit that lists some of the tools that you could use in systems change. So it has quite a number of tools. Each tool is listed here, and a link to a page where you can find more information about that particular tool is also available. So you could click on any tool, and it will take you to a page where more details about that tool is explained, and also a download link is also provided if you wish to get a template to start you off on this journey. So the Systems Change Toolkit has around 16 or 15 tools that you could explore just to understand more about them in detail. Yeah. We've also made the site to be mobile. We've made the site to be mobile, so it's accessible across different devices. For people with laptops or desktops can use it. People with tablets can also use it. People using mobile phones, the site is responsive enough to allow them to browse through it. Yeah. So in regards to how the playbook looks, this is how it looks. So it's a microsite. You can access it on this link. Let me just share the link on the chat for somebody who might want to interact with it more. So it's a microsite. I've explained how you can navigate through it, the different pages that are available on the pages that tell you, introduce you to systems change, like giving you the definitions, explaining why it's important, and also the pages that have the approaches to systems change and the toolkit. I think that's all for me, Ian.
Thanks, Felix. Really helpful just to give a flavour for how we've put all of this information together. Thanks also for sharing the information in the chat. There was a question in there about availability. Well, as you can see, the testing site is available for everybody on this call to have a look at and play around with. And we would love your feedback. We're giving you an early insight into this work, working in the open a little bit. So this is a great opportunity for everybody to jump on and have a look. Obviously, after all of the other sessions have concluded today, and do share us your feedback. I'll cover that a little bit more when I wrap up in 15 minutes or so. But I think it's fair to say this is very emergent for us. It's work in progress. We've done a lot of crunching to bring it all together, and I want to thank Robbie Bates and Alessandra Podesta, who's on the call, and everybody else that's been involved in bringing the information together. But a bit like Alvaro shifting the system in Costa Rica, our challenge here is not to have a perfect plan for the playbook, but we want people to get their hands dirty using it and working with it, and seeing how helpful it can be on a practical basis. because that's the intent. This is difficult work trying to shift a system like this. So it'd be great to encourage you all to dig into that, have a look at the content and play around with it and apply it in your work, and let us know what works, let us know what doesn't, but also let us know other things that are working for you. And our vision for this is that it becomes a bit of a repository, a place where we can try and bring together not just tools and framings and the rest of it, but also stories of change that can inspire people in their work. In the way that in the intro I talked about seeding a movement for change, we're really keen here to bring information and tools and approaches and case studies and stories together into one place to continue to do that, to inspire people towards the kind of change that is not only necessary but possible. So I'm going to introduce Alessandra Podesta, who's Senior Innovation and Learning Manager in my team, and has done a lot of work behind the scenes on the playbook. And Alessandra is going to pick up some of the questions that have been in your chat. And for the next few moments, we'll just have a bit of a Q&A with myself, with Charlie, and with Felix. Welcome, Alessandra.
Thanks, Ian, and thanks, Charlie and Felix, for the presentation. Yeah, just a few questions in relation to the playbook, but also in relation to system change, which I think we hear quite a lot of discussion around in the sector. Yeah, I think the first question is something that Charlie really mentioned a little bit and touched on during his presentation, but if we can go back to it, and it's simply, how can we evidence that system change has happened in relation to the 4 keys? What practical example do we have on how to use the 4 keys to evidence change and also impact? I don't know if Charlie, maybe you could help us answer this question a little bit more.
Yeah, I mean, I think it's a question that comes up often because in the current system, there are all sorts of ways of measuring stuff and providing a very narrow accountability to donors, particularly about how money is spent. But that takes no account really of kind of accountability to the field or to ultimate users or to recipients and what have you. So our current evaluation methods are backward-looking, they're judgmental, they use narrow bits of data, they use narrow sources of perspective on systems, and generally speaking, you need to adopt an approach which is much more about learning in real time. It's about learning rather than judging. It's about making connections between things and making sense of change as it happens, and that means bringing in many different perspectives. But I think that if you drill down into the keys, you can start to see when a relationship's changing, when are people in new relationships maybe more egalitarian or more open, what effort has been made to do that. Has that shifted power? Does it create power? Does it shift power within established organizations? Are there measures of that you can imagine through that power mapping tool that was in Felix's presentation? Where can you see new kinds of purpose emerging, or new conversations at least about that kind of purpose? And then how can you see resources flowing in new and different ways? And you can start to measure that. Where are new resources coming into the system? Are they being used more productively? So on and so forth. So what you can do with the keys is, if you can use some of the tools that Felix was talking about to then make them more operational, then you've got a bit of a framework for thinking, is this system changing? Are the components of change coming together? Is there something lacking that's not being used? And you can use it to create a bit of a picture, I suppose, rather than, and which you could use in real time, rather than a backward-looking evaluation framework which tells you what happened to a particular pot of money in a particular kind of program. It's not easy, but it's not impossible. But it does require a different kind of mindset about what evaluation is, and that evaluation is not about making judgments and assessments, it's about learning.
Thanks, Charlie. Another question, like sort of related to learning, but also like basically like how do we move on from the system that we're actually stuck in? And this is a question from Nasir Ahmed that he posted in the chat quite early on. And it's making the observation that system change also relates with government policies and procedures. And often local actors are bound to follow these systems. And they're trying really to do their best to fit state requirements, I think government requirements as well. So there are quite a lot of challenges to handle the situation. How can they overcome this and promote systemic change when you're still stuck in the old system?
Well, I'm not going to pretend it's easy, but I don't think systems are monolithic either. And lots of systems are under intense pressure. So there are kind of pressures, cracks, conflicts, which you can find. Systems are rarely completely comprehensive. So there are often kind of areas outside systems that are neglected that might create niches in which you can work. So in some cases, as in Alvaro's case, Alvaro started in, Ian's right, in a kind of little niche in 3 barrios. But at some point he did connect with formal power in government and managed to create a space in which a new thing could develop with inside systems. So I think you have to look constantly for players and actors within systems who are frustrated by the way the system is working, and players and actors outside systems who think they have new possibilities. And I think our feeling is that often the most productive role is a kind of insider-outsider who can move between outside systems where they're being entrepreneurial, using opportunity to develop new things, and inside systems working with existing power and trying to draw those resources and people towards them. Not easy, not impossible.
Yeah, not easy, and I think it'll take time. But it's, as you were saying, it's really important to not just look at the problems, but the possibilities. I think this next question is for both you and Charlie, and you, Ian, as well. And I think it's an interesting one. So, especially if we think maybe about the humanitarian sector, but why do you think we need to aim at systemic change? Isn't positive impact, especially in a crisis response setting, not good enough? You know, when we have to really respond quickly and make sure that things happen and we support people in crisis. Like, why systemic change? Why not making positive impact is enough? I don't know, Ian, if you want to start. Oh no, go ahead, Charlie.
Well, I mean, I'm not an expert in humanitarian systems, but one of the things I notice about them is that systems often perpetuate the very problem that they're designed apparently to address. And humanitarian systems often perpetuate a sense of powerlessness rather than building up the power to shape your own lives. And so if you understand the future of systems like this as being about creating the power for people to shape their own lives with resources and a sense of purpose, then our current systems fail miserably against that. There lots of systems, state systems of different kinds all over the place, are really good at fighting fires and responding to crisis and mobilizing when they're needed. What we're really bad at is shifting the context of power and purpose so that different kinds of ways of life, different preventative, early solutions, if you like, foundational solutions, can come forward. And so that's why we get trapped in metrics of we're doing a really good job, we're very busy, we're very needed, lots of resources are coming through, but actually we're not really shifting the things that really matter. And that, I think, is the frustration that a lot of people interested in systems change have, that we're terribly busy, we're really effective, we're hardworking, and yet nothing really seems to change. And that's because we're not really changing the fundamental underlying conditions which determine whether people can live lives of sort of power and purpose.
100%. I mean, I don't have a lot to add to that, Charlie, other than to say that the title of a favorite book of mine is called "Trying Hard is Not Good Enough." You know, and part of that, I think, recognizes that many of these systems, humanitarian systems, but also systems of government in the West more broadly, were born of an era that no longer exists. And, we're dealing with the fallout from issues of, colonialism and racism. There's a lot of reckonings that the sector has had with itself, but that actually all sectors are having with themselves at the moment. So no change, not changing is not an option in many respects when we're dealing with big issues like that. We talk about a system that concentrates power, that's risk averse, that doesn't have evidence of innovations, that is too reactive even yet. And as I said in my intro, there are many interests that are well served by the status quo. And so that's why we need to build these little models of alternatives, often at the fringes, often in a more, what I sort of think of, this might even be your phrase, Charlie, of a sort of systems entrepreneur approach, thinking differently about how we go about creating change.
I think we have time for a couple more questions, and the first one just came through the chat, which is an interesting one. But what obstacles have been noticed or can be expected when we work towards system change? And also, who are the lies that are needed to drive systemic change? I don't know, Charlie, if you want to go ahead.
Yeah, I wonder if I could just share my screen again, and I could just show you this diagram. Hold on. Does that share? Let me just share this. So one question is, so say you're in a system one, you're in a current system, and it's both powerful and breaking down and frustrating because it's not really changing things, and it's sort of almost serving itself. And there are lots and lots of systems like that now where people are trying to come out of them. And we think that one way of thinking about it is that somewhere between system one and system two, on that orange line there, is a kind of force field. It's kind of like a gravitational force field, which keeps the current system in place, even though we know it's not really working. It's not fit for purpose. It has all sorts of unintended downsides. And understanding, I think the people who really change things understand that force field. And the force field is made up of risk aversion. Oh, I'll lose my job, or I'll get found out. Sort of norms. We don't do that kind of thing around here. Assumptions and framings, like the ones that Ian was talking about. This is a humanitarian system. It looks like this. It's always looked like this. So there's a sort of set of things that happen there that promising alternatives then hit this kind of force field and they get drawn back. And so we think understanding what that force field is made up of, risk aversion, lack of finance, lack of skill, lack of capability, need for alliances, changing frames and norms and frameworks and what have you, you can sort of line up some of the cause, some of the factors in that force field, and then try and work your way through them. And generally speaking, we see, I suppose, three different approaches to escaping the gravitational pull of the current system. One is a really sneaky, stealthy approach, which is to sort of almost look like the system and don't frighten people, but slowly make your way through it and move towards something else. Another is to kind of just leap over the force field, because you're going to start working in system two already. You're going to work in some new space, some unoccupied space, some space that has been made available through whatever factors. And then the third is a direct challenger approach. And sometimes you see people who just say, you know what, this system one is just completely broken, and we are going to smash through to a different kind of system two, and almost try and break up this current system and release more energy to change it into a different system. So I think I would recommend thinking, I'm going to need allies. It's going to take quite a long time. There are probably going to be setbacks. This force field is important. and I need to understand that I'm probably not going to get through it on the first go, and I need probably other people who are going to help me get through it. And so being kind of skillful about that and patient enough to have enough goes to do it, I think is really, really important. Again, not easy, but not impossible.
Thanks, Charlie and Ian. A few more questions in the chat. I think we're just finishing up our time. So over to you, Ian.
Thanks so much, Alessandra. Thanks, Charlie, for your sharing your wisdom with us today. Like this has been really fun. We could talk for hours, I know, and we're barely scratching the surface. So I think this is a conversation and a line of inquiry that we need to come back to. So thanks everybody for joining us today. Join me in thanking our speakers, Alessandra and Charlie and Felix, and the behind the scenes support from the START team and our translators. There are more ways you can get involved in this work. That's been shared by Alessandra in the chat. Do reach out to us, do message us, do get in touch. We're actively working with and testing the playbook at the moment, with the view of pushing a live version publicly available in the new year. We've got a few minutes left before the next session starts, so do look after yourselves, do go back to the attendee hub and find your way to the next session in about another 8 minutes time. The next session will be discussing localization from the perspective of our hubs, and there's some real insights that the team are going to be sharing and discussing on that call too. So thanks everyone, and enjoy the rest of the session.
Bye.